Hello, everyone. This is Chadi Alraies from RSH 2026. I'm privileged to be with Dr. Ahmed Al Qudaimi to talk about the RSH putting together challenging cases tracks and what is the value of that. Dr. Qudaimi, thanks for being with us.
Also, I am so glad to be with you again. I shared from the first structural meetings until the fourth one. I'm so glad to be one part of each meeting. Actually, this time the challenging cases presented by the speakers and by the moderators during discussions was very valuable, especially when there is a tips and tricks in these cases. And those tips and tricks, it's a very teaching ones. And I found out that in these meetings, the benefit was much better comparing to the previous one because of the lot of expertise
Right.
present around, and there were many cases and challenging, and these cases were managed in a very smart ways and give a message how to deal with those cases if you face them in the future.
Yeah, it's a very important point, especially if you see it once here and you see how the troubleshoot the problem. So in case in the future you have the same thing, you know how to bail yourself out.
Absolutely,
Yeah.
this is the target.
Oh,
When you see how these cases were presented and how they troubleshoot and how were they managed,
yeah,
so we will keep in mind this idea, because if you see it and you see how they were managing it, and you saw the outcome
yeah,
of those of the way of management,
yeah.
and the also the discussion of the panelist will enrich the technique that the operator used. Either they are with 100% or they have some comments on the technique, and it's also a valuable ideas.
Absolutely. From your experience, last meeting, this meeting, these challenging cases, are they redundant? They have the same issue, or every time you see something new?
Well, actually, and to be honest, every times we are seeing something new, and we heard also cases and difficult cases the operator faced. Uh, I mean, in a totally different than the previous one,
Right. Yeah.
and I could say confidently that the grade and the level of the cases
It's getting
more
complex.
up
Yeah.
in this meeting comparing to the previous one, which is really amazing. And you
Yeah.
can find out till the last time people are there
Yes. Yeah.
because they want to catch something new.
Absolutely.
Yes.
Yeah. I mean, you're right. I mean, and that speaks also that we are keep pushing the envelope by trying something new, causing not harming the patient, but things happen because the patient are complex. Yeah.
Yes, and also as on the other hand, the devices on the market increasing,
Yeah.
and they are modifying these devices, and those modifications which have been done and going to be done doing on the devices, it's very helpful. You know, the target is the safety of the patients
Absolutely. That's the
and
bottom line.
the perfection of the operators and the perfection of the operation itself.
Absolutely.
Yes.
Well, Dr. Ahmed, thank you so much again for great insight and for helping us with these venues to educate the next generation and the current generation.
It's an honor for me.
Okay. Thank you. Thank you so
Thank
much.
you.
Watch the videos and others on the YouTube channel. This is Chadi Alraies coming to you from RSH 2026. Thank you.